So, welcome everybody to Got Transition Radio, which is brought to you by Got Transition, the National Center on Healthcare Transition, funded through a cooperative agreement with HRSA and the Maternal Child Health Bureau. For those of you who don't know and are just tuning in, my name is Mallory Cyr, and I am the Youth Program Manager for Got Transition, the National Center. And I am so glad to be back after our short summer break with my co host Eileen Ferlenza of Colorado. So much has happened since our last episode. But before we get into what we've been up to, I just want to remind everybody how you can contribute to the conversation of this episode. On the webinar panel on your screen, you can see a chat window and a box that says questions. Throughout the episode, we would love it if you would type and contribute in either of these places, and Eileen and I will do our best to answer questions and comments throughout the show. We really want to hear from you, so don't be shy and be sure to jump right in there. So, Eileen, wow, what has happened since we last met?
Well, hi everyone. Thank you for joining us today. I'm joining you from Colorado where we're having some wonderful fall weather and it really just smells and looks like back to school time. So really glad to be back. Our family's transitions over the summer were quite plentiful as our oldest daughter Emily left the nest to go to grad school in Atlanta, which was a really kind of a big deal. We'll talk a little bit more in depth about that. And my youngest son, Michael, who's 14, has transitioned into high school from a middle school experience. And he's just now, just this week, went ahead and made some more adjustments in his schedule. We've been in school for over a month already. We start the 10th of August. So we've been transitioning that and dealing with some of his allergies, and he's got some oral health issues that we're also struggling with, and of course Holly and Cody, the ones in between, are all full of transition as well as we're getting back into school. I think related to this topic is because of the back to school, Holly's got new care providers, and because of her care team, including high school and college age students, we're in the middle of helping Holly with her transition of having new care providers in the home, all the training that goes along with that, which can be stressful for her. And then Emily's journey into grad school, all the transitions that include looking for a health provider, trying to straighten out the health insurance plan, of course, managing ending a relationship in Denver while she moved to Atlanta, which is all part of the plan. Her really learning about the different money management for grad school, which was fairly different from undergrad. And of course, all the transportation issues. And I know we're going to be talking a little bit more about that, but it has been a full summer and a fall of transition. And as all of my kiddos are in this age range that we're looking at, it's been interesting to look at it through the lens of the National Center and some of the resources and lessons learned that we can talk about on the show like this. So thank you for giving me an opportunity to give that update.
Definitely. And, it's funny as I hear you talk about that. Emily and I are really good friends. And it's funny to me as I remember how parallel our journeys really have been. I remember we were together at a conference and we were talking about whether or not we wanted to take that plunge to move to another state and to pursue grad school. It's very different from undergrad. And I want to kind of remember that as we talk about this transition, that it's definitely not like just moving away to college. And so we had all of those conversations, but now both of us are living in different cities. And we both know that it wasn't easy for either of us to get there. And I think that is a prime example of how challenging transition is, even if you don't have special healthcare needs. And when you do, it makes it even more challenging. So I think, the from a different state transition is huge to begin with, and then adding those additional supports that you may need, it's really a hurdle. um, So, for those of you who may not know, or if you're just tuning in, as of August 1st, I actually moved from Maine to Boston to pursue my master's degree in public health at Boston University. And that's a huge transition in itself. But also, my boyfriend, who also has special healthcare needs and was living in Nevada, uh, chose to move out here with me. So we are pursuing education, employment, living together for the first time, finding healthcare providers, all kinds of transitions. But just physically getting here was probably the biggest hurdle so far.
That's just so amazing, Mallory. Thank you for sharing that. We could probably do a whole series on the life and times of Mallory Cyr. And so thank you for being so open with all the transition. I think what's really amazing is that, when we talk about health and health care, that we need to understand that those are two distinctly different things. It's two different ways to organize as a parent. It's a different way to organize my thinking and my support for my kids with and without special health care needs. It's an interesting way to talk about what are my expectations of them and what are the expectations that they have of me as their parent. But I think the most amazing part that I always come back to in working with national initiatives related to the medical home model, what we know is that 90%, 90% of our healthcare outcomes are dependent on what goes on outside of a clinical intervention. And so really health care and health intervention and health care access really is only about 10% of the indicators of what's going to determine our health and wellness. And I think you talked about that, is that, the finding a healthcare provider in Boston, your new town, is only one piece of all the other things that you're navigating through your transition. And the housing, the money, all of that other huge pieces that really paint a picture of stability regarding mental health and emotional health, safety and awareness. Where are you going to live? What are the safe routes? As young women, how are you protecting yourself in terms of your personal safety? And I think it's a really interesting dynamic for us to talk about on this radio show. When we're talking about youth transition, we're definitely talking about healthcare because that's what the National Center is dedicated to. But from the personal and the family perspective, the healthcare piece is a significant part of what we're talking about in light of the fact that the whole picture of health and wellness includes all those other pieces. And I think we need to keep that into perspective about how the anxiety and loneliness and other behavioral mental health issues play into the overall health outcome of a young person going away to college. So I think it's just an incredible time to study this and to just open it up to parents and to other people that may be listening today to talk about if they have ever had a similar experience with this.
And I know that you actually had quite a bit of involvement helping Emily find housing. She's in Atlanta now, and because of her age bracket and what was available to her, that was a real struggle. Can you talk a little bit about that from a parent perspective?
Yeah, you bet. I think I may have shared with you guys before on the last radio show is that as Emily was preparing to look for housing and to go to Atlanta to look, she could not even do that very thoroughly because she's not 26 years old. She couldn't rent a car. And most of the rental car agencies will not rent to people, even if they have a full, clean driving record and full insurance. She was not able to rent a car. So that was a challenge. How are we going to look for housing without having transportation? So that meant that I had to either go with her, which is kind of the dichotomy of what we're trying to do in terms of independence, or she would go and completely rely on public transportation, which may not have access into residential neighborhoods. So that was a real challenge. She ended up taking that approach that she just went without the access to a rental car and did everything by public transportation. And so that was her way to kind of get a feel of the bigger areas in Atlanta. But she ended up finding her apartment just simply online. The university put together a group Facebook page where members of this incoming class were able to post solicitations, if you will, of who was looking for a roommate, and only going by what she learned about neighborhoods from her brief visit, she was able to connect with two other young women from the class and found her housing based on a Facebook connection. So that's really interesting, and that's different for me as the parent. And that's part of my letting go, is just trusting that that was safe and that she'll get along with these two young ladies. And so far, so good. We're about 6 weeks into it, and that's going fairly well. But it all was done, even the signing of the lease was done online and sight unseen. She never did see the apartment until the day we moved in, in which I was able to be there on the weekend that she moved in. So all of that was very different for me as a mom. Um, and making sure that I just had to trust that she knew what she was doing from the virtual perspective, and that she was making a wise decision. And I don't know, Mallory, how that would work with someone who has mobility issues like you've talked about before, or more significant special health care needs. So I don't know if you've had any of these kind of experiences, but I think from a parent perspective, that was definitely one of the scarier parts for me in my role of watching my daughter transition into college.
Yeah, it was for us. That was one of the biggest challenges, was not being able to have a really tight timeline like that where we could move, shortly before I would begin classes, and the issue of accessible housing. Not only is there a huge lack of accessible housing in Boston, but the real estate market here is sort of its own entity where you really have to jump on things or you miss them. And so many of the places did not become available until September 1st, which meant I would have been starting classes with no knowledge of the area, not knowing how to navigate the city, not knowing what was safe, where I was going. Um, and during all of this, I was still getting things in line with school and my financial aid. So that whole process was really stressful for me. And also, with our situation, accessibility in Boston is not a common theme. It's not something people talk about. It's not something people are aware of. We checked with disability resources that were in the area. We were given very minimal options. Such as senior living centers or disability segregated housing that wasn't in safe areas. And many of the realtors never even called me back. I would say what we were looking for, I would give them really specific details, and we would get questions like, well, is one or two stairs okay? And that is not accessible when you're a wheelchair user or use mobility equipment. There can't be one or two stairs. That's not accessible. And the frustrating thing was for us was that we weren't asking for really exclusive things. We were asking for the same opportunity and the same living experience that our peers have as young professionals and people going to school. And so as someone who is pursuing that education and paying the same amount as my peers, I want to be able to feel safe and be able to focus on my academics and our work, and not having every day to day task like taking out the trash or doing laundry, not have that be such a huge ordeal that it consumes our energy or isn't a safe thing to do. So that was a huge process for us, having even less options than somebody who is just going on Craigslist in hopes of finding roommates at an apartment.
Yeah, I think you bring up a good point about Craigslist, because again, I will remind the audience now that with my daughter Holly having significant special health care needs, it's unlikely that she will ever live away from home, or at least in my lifetime, probably. Um, and so she stays home. But how this impacts her is that a lot of her care providers, as I said, they have left, or they are adjusting their back to school schedules. And so Holly has been, we're back to looking for new care providers, which some of you will know is a very challenging process. And what really amazes me is so many of the service provider agencies in our area here, their number one recommendation to me to find care providers is on Craigslist. And I have a really hard time doing that. I have not done that because of Holly's safety and her vulnerability. With Holly being nonverbal and having all the complex healthcare needs that she has, I think her safety is her number one concern. So even using, we talk about the utilization of more typical avenues, if you will, from a social media perspective for connection on housing and whatnot. For some things, for some purposes, those mechanisms just don't work. And the care providers, finding care providers when we're talking about, again, the transition of, for you, Mallory, moving to a new city and having to find new support staff that are going to come into your home, if that's something that you end up doing, or for, to maintain the transitions of excellence when the care providers are leaving our home-based care. It's really a difficult challenge. And to remember too that even though Holly has a lot of interesting healthcare needs, at the end of the day, she's still a 23-year-old young woman, and she really wants to be socially relevant to what's going on around her. And her anxiety, her sadness, might I say, her depression during this time has been pretty noticeable and pretty significant, as she's noticing that everyone around her age, are moving on and doing other things, and she's still at home. So um, I'm glad that I at least am aware of that, and we can adjust some of our scheduling and address it with her. But that's part of the reality for her transitioning into the adult healthcare system while she's still living at home. It's harder and harder to find age appropriate activities for her to do. Um, while everyone else is kind of in this age group, are kind of focused on the college or a career path. So I think that that's an interesting piece to kind of think about as we talk about transition, because again, the healthcare piece, the accessing healthcare, as in finding a provider, is a big part of this discussion. But so are all the other pieces that will provide a solid health and wellness picture for a young person in this age group. And I don't know if there are any listeners out there that have had healthcare transitions, whether they're leaving the home or staying in the house, that can talk about secondary results that involve mental health or depression as a result of the actual transition itself. Um, or if there are listeners out there that might have some feedback on what the experiences that they've had if they've transitioned to a new state, and what that's been like for them in finding all these resources and accessing the services that they need.
And that's a really great point about finding good caregivers that are trustworthy in the process of that, and the anxiety piece. I want to get back to that. We had a question from one of our listeners about ways that I managed all of that stress, and am continuing to, as grad school picks up to a rolling boil. And so I actually want to end with some advice and some learning experience that I've gained from this experience. But first, I want to talk a little bit about what it has been like trying to find caregivers and providers. And unfortunately, it's really sort of been an ongoing process for us. I've been really lucky to have so many amazing contacts through my experience working with Got Transition, our learning collaboratives. We have providers that know me right here in Boston, so I've been emailing them and reaching out. The one thing, however, is that in Massachusetts, everybody is required by law to have health insurance, which is awesome. However, that also means that everybody is trying to get in to see providers. So I'm lucky enough to be able to keep my specialist that's in Maine, but I'm hoping to transition my primary care to have as a main contact. I've also made a point to cover as many bases medically that I could before I moved so that I would know what my baseline was and be at my prime health when I was moving. So, in terms of insurance and all of that, it's still an ongoing process trying to uh, align our state supports. And a lot of times I don't necessarily have the time to follow these phone calls through to the end when you're being referred to different people and calling different numbers. Owen recently has been really on a roll with the healthcare transition piece. Owen is my boyfriend who moved out with me, and he has been speaking with providers, but even still, they're telling him things like he may not be able to get in until December, which, as having an awareness of the healthcare system, I'm like, oh, that's actually really good. But again, it's funny, and I've said it before here, even though I spend a lot of time on Got Transition and, talking about these things, for me, it really has taken a back seat. The medical piece has been on the to do list for a long time, but it's not so easy as something I can just check off. I've been focused on school, getting acclimated, really knowing the area. And, now we feel comfortable looking for providers. So, one thing that did work really well for me was working with my home care company, who were super understanding and were actually talking about my move before it happened. They arranged so that I could get my meds and all my supplies in my new apartment with no problems, and no gap in not having what I need. So they're also playing a critical role in helping me make sure I get my blood work and my tests that I need to find out, how my health is doing before I hit a crisis mode and find myself without energy. Um, so I wish I could say that we have checked off all of the transition healthcare tasks off of the to do list, but there really are so many pieces. And with that, before I move on, I really want to take a question. We have a question that says, I live in New York City. Where can I find outlets to find providers that work with disability adults with cerebral palsy using a multidisciplinary approach? Um, that's a really good question. Um, and I know that if Owen were here, he would probably have some to speak of on that. He has spina bifida, and so he has been reaching out to a clinic that is actually out of a children's hospital. But because he has aged out of those services, they were able to refer him to some providers and some specialists. So I would suggest starting with what you know uses a multidisciplinary approach, and see who they may be able to put you in touch with. Eileen, do you want to speak to that?
Yeah, I think that that's really good advice is to look at, who are the players, because we are talking about transition, and that generally means perhaps it's someone in their 20s, maybe early 20s, early 30s, is that oftentimes the systems of support in states that are grounded in children or pediatric care then also have collaborative partnerships with those in the adult system. So looking in the more pediatric or adult or pediatric or children's system, there's also an affiliation with the university, your AUCD, the Affiliated University Center on Disabilities, is also very helpful. And you can find that, you can Google that for New York. I don't know it off the top of my head. I know that in New Jersey, it's the Elizabeth Boggs Center, for example. And then each of those universities have the LEND program, and that is the Leadership and Education for Neurodevelopmental Disabilities, and that's another program that will connect with services. And then every state also has a Developmental Disabilities Council. They're typically called DD Planning Councils or DD Councils in general, and those are also federally mandated in every state, and that's a good place to look, as well as some of the states also um, will have transition programs through their local education system, through the Department of Ed, because education mandates are now indicating that schools have to track young adults into their early 20s to measure independence, which is a performance indicator for this education system. So there are certain safety nets that all states have. Um, and I think those are just a couple places to get started. But feel free to email or contact us, and I can help you more thoroughly offline of this call.
Definitely. And we have another question, and it's about the process of transitioning health insurance. And that has been, again, just another small piece of the puzzle, and there are so many options, and because we are still in the process of those changes, and also we're really short on time, I'm going to encourage everybody to tune in next month to hear about the actual transitions of healthcare. But for me, on that piece, I really have gone worked really closely with the Catalyst Center, who is actually out of the School of Public Health at Boston University, about what steps to take. And I'm struggling as to starting in Massachusetts versus where I'm coming from, and my advice is to really look at your options and figure out your plan before you cancel anything in the state that you're coming from, so that you're not left with gaps in your coverage. There are options through your school, employment, state programs, and it's very complicated. So we definitely will talk more about that next month. And I want to kind of go through these quick lessons learned and then get to some final questions that we may have. So, some things that I have learned during this whole transition, number one is aim big, have big dreams, have big goals, but also be realistic about what you're putting yourself into. For me, I looked at many schools. But I also realized I have a lot of connections in Boston. It's, a couple hours away from my family. If anything, bad really did happen, they could be there. We just had such an amazing circle of support. And I could really see myself living there versus other places that I applied. So, keep your eye on the goal, but also remember that you're going to be there and living this. It's not just, where you think it might be fun to take a vacation. Another thing, don't take no for an answer. We talked to a lot of people when we were looking for housing, and we really didn't want to settle for housing that we didn't feel safe or comfortable living. We were fortunate enough to have resources to arrange it so that we could have something that worked better for us. And so I really encourage you to look at all your options and not just talk to one person or one organization. Um, Make lists. I know Owen is probably laughing right now because we have lists all over our apartment. But truly, make lists about what accommodations you may need, whether it's door measurements for an apartment, what kind of transportation is easiest for you, academics. Again, grad school is very, very different from college or high school. What providers you need to find when you do have complex healthcare needs. It's not necessarily as easy as just going to a clinic. You're going to need to align a lot of things and also break it down. And this is something that I heard on Accepted Student Day. when thinking about housing and, accommodations, think about what things are really essential for your health and safety, like an accessible bathroom or obviously a doorway that you can get in and out of, versus something that might just be nice. Like if you want it near a Starbucks, which obviously, is different levels of essential, but it's a little bit different than having an elevator in the building. So really break that down when you're asking for what you need. Don't be afraid to talk to people. Really network, tell your story, tell people what you're looking for, what you're hoping for. Everybody knows people, everybody has connections, and don't be afraid to just go out on a limb. And that's actually how we found our apartment. I really just got crazy writing emails. Found this building that I really thought was probably out of our league. But after talking to people, I realized that we could make it work. And again, for us, we had to go back and forth with Owen in Nevada and me in Maine, signing leases via mail and scanning things. And, but really just don't be afraid to ask people. The worst thing they can say is no. So, tell your story, talk to people, really network. And in terms of the stress management, I think I'm still getting a hold of that. But the biggest thing I can say is really try not to make it huge in your head. When you say, I have to transition to adulthood, that's an unrealistic objective. Really look at it and say, what can I do today? What is reasonable? Um, what do I need to do to get to the next step? Whether it's making one phone call or, sending one email or signing a paper or, little things that can make you go, okay, I've done something. I'm moving forward. And don't forget to breathe. Really take it in. Look at what you're accomplishing as you go. There are going to be those frustrating moments. And so that's when it's really, really important to have that support system, whether it's your family or friends, just be able to share with people what you're going through and find support in that. So those are pictures of me and Owen in various stages of transition. And so, it's being in Boston, having a really great class, coming home, to our home that we created. Those things really kind of remind me why this whole process was worth it. So I know we are really, really getting out of time. I really encourage you to check out resources. Owen and I have a Facebook page actually where you can follow our transition and ask us questions about how we got to do different things. There's a great tip sheet on the Got Transition website about finding new providers. Also, a brief on transitioning to college based on a webinar we just had. Although, again, this grad school animal is very different from regular regular college, quote unquote, undergrad. And also my email. So again, find us on Facebook, Twitter. Tune into our previous episodes. And we are actually going to be getting some feedback from our listeners about timing and the format of this and where you listen from, how you listen. We really want to make sure that these episodes are about you and that you're getting the most from them. So, yeah, the time is to be determined. The next episode will be October 27th, I believe. And so we are really going to be changing it up within the new year and getting a lot of feedback. So Eileen, do you want to wrap up?
Well, I think you've done a wonderful job. And again, thank you so much for bringing us along on your journey. I learn a lot from you, and I'm sure our listeners do as well. I just want to end by saying I'm going to make a bumper sticker about Starbucks being a different level of an essential. I think that's really profound. So, knowing you the way I do, I know that Starbucks is an essential part of your health and wellness. So, more power to you, my friend. So, until next time, thank you everybody for being here, and thank you for your ongoing listenership and your support. And keeping health first is so critical. And remember, go ahead, Mallory, your sign off line.
Every transition is unique, just like you. Thanks for tuning in.